Today, I want to tell you how you can audit your plant-based diet for optimal nutrition. Now, this is really important, and you can almost keep a little copy of this, for when people say, where do you get your protein? Where do you get your calcium? Where do you get your iron? Where do you get this? You can pull it out and say, well, it's interesting. I do an audit of my diet, I don't know, every quarter or so, and I'm doing pretty well. How about you? Where do you get your fiber? So this is a funny conversation. I had this thought this morning, and then I was talking to some patients today, and we were talking about kind of doing an audit of their diet. And I was like, I'm going to make this a video, and we're going to talk about how you can utilize it as information for those who want to be nutritionists in your life who aren't nutritionists, who are worried about your quality of diet and your nutrient intake. So utilize this tool, and we're going to talk about the 10 nutrients that I want you to focus on, and some of the foods that you can look at, what type of levels we're going to look at, and how, again, you can maybe optimize your diet naturally. But it's always good to have data, guys, because when you have data, you can make informed decisions. There's no emotion to it. It's not because, you failed, or the plant-based diet can't give you what you want. This is just data. You're just eating right. I mean, I've done an audit of my diet, and sometimes like, I need to add a little more of this or cut away a little of that. It's normal. It's all good. No judgment, but power in knowledge. Okay, let's dive right in. Oh, by the way, if you're new here, please click that subscribe button. I keep forgetting told. My two boys work for me now, and they're like, Mom, you need to start telling people to hit the subscribe button. So please do it for me. Click the subscribe button. If you're new to me, welcome. My name is Dr. Lori Marbus. I'm a board-certified family and lifestyle medicine physician. And that means that I love to help people get well. We talk a lot about healing. We talk a lot about mindset. We talk a lot about plants in the new book, The Ultimate Guide for Plant-Based Eating. It's on Amazon, Plant-Based 101. But I'm licensed in all 50 states. I am still accepting patients. I'm getting kind of full though. So if you are looking for a plant-based doctor, feel free to go over to drmarbus.com. Happy to see you. I can see you anywhere in the world, but I can practice medicine in the 50 states and DC. Otherwise, then it's more of a just like, hey, you might want to do this and speak to your doctor about that. So getting back to the 10 micronutrients I guys want you to jump on. All right, let me get over to my notes. Because we understand that when you transition to or maintain a plant-based diet, it absolutely offers the best numerous health benefits, right? Including heart health, weight management, and the reduced risk of chronic diseases like type 2 diabetes, heart disease, autoimmune disease, those type of things. However, ensuring your diet is nutritionally complete requires some attention to detail. And you don't have to do this all the time, but probably think about doing this for about 7 days every 3 or 4 months. Okay, that would be the cadence that I'd want you to think about. But we're going to particularly focus on some very specific micronutrients that might be a little harder to attain on plant-based sources. And depending on where in the plant-based world you entered in, you may be missing out on a few things, because some people, what I describe as guru syndrome, they get a little confused and they do a little too much of one thing and disregard the other plant-based foods because they're either fat phobic or they heard they need to do something like this. But anyway, when you become more restrictive, this is when you're increasing your risk of missing out. So we're going to talk about that too. So here's our guide to auditing your diet for the optimal health. So number one, I want you to use a tool like Cronometer or MyFitnessPal. I prefer Cronometer. I feel it's a little bit more accurate. And now we're going to jump into, it's just an app you can download. Here are the key nutrients and how we're going to focus on this. So number one, yes, I'm going to speak to you about protein, and I'm going to tell you why. Okay, so as we get older, we need a bit more protein. So you want to be aiming for around 1 to 1.4 grams of protein per kilogram per day, okay? And why are you saying this, Dr. Marbus? I thought you could get plenty of protein on your plant-based diet. You absolutely can. However, many of my patients are women. Many of my patients are older ladies. They have smaller appetites. I need them to really hyper-focus because they may have heard somewhere, I need to eat a pound of vegetables for breakfast. And guess what? They're not hungry till later in the day, and there's no way they're going to be eating enough food, one, to maintain weight. Sometimes we're losing too much weight or we're struggling in that. nor the protein. Protein is important as we get older to maintain muscle mass. We do not want to lose muscle mass, guys. As we get older and things set in, like we call sarcopenia, this is an absolute game changer for when you lose your muscle mass, you lose your metabolism, right? You become more insulin resistant. You become more fragile, higher risk of falling. So we're going to highlight the need. And if you're meeting that need, fantastic. Otherwise, plus by paying attention to it, if someone asks you, where do you get your protein and how much you're taking in? Say like, well, I'm taking in more than the RDA, the recommended daily allowance. And here's the evidence. So can we put this to rest? And by the way, how much fiber are you eating a day? Where's your log? That's what I want you guys to do. Okay, we talked about how much you need. And if you're more active, you may need even a little bit more, okay? So why does it matter? Because again, like I said, it's important for muscle maintenance, muscle repair, hormone production, and really overall cell function. The great sources. I love soy products, guys. They're high in protein. They decrease risk of breast cancer. They're good for your bone. They lower your cholesterol. It's fantastic. The whole soybean's even better. You can do the edamame, the whole soybean. You can do like tempeh. You can do soy curls. Now, those have the phytoestrogens, the isoflavones at a higher amount than the tofu and the soy milk. These are still good. They're just not getting as much quality of the micronutrients, especially the phytoestrogens, when you eat the more processed tofus, the more soy products. So they're all fine. Just realize that you're sacrificing. If you're really wanting to get the highest quality, you want to go for the whole bean, which comes with any food we talk about, right? Other things you could be looking at are lentils, chickpeas, quinoa, nuts, and seeds. Fantastic. Okay, next is B12. When you get your B12, they recommend RDAs at 2.4 micrograms per day. I would say let's push that level up to 500 micrograms per day. And let me explain why. So when you think about B12 in a whole food plant-based eater, you're not eating anything that has B12 naturally in it, like the flesh of animals, because they eat dirt, they eat the bacteria that have it. It migrates to their tissues. That's how it's done because it's absorbed in the upper part of our tummies. Our gut, our tummies. I feel like I'm talking to a 2-year-old. No, Lori. The first part of that in small intestine. So as you go into the lower aspects of, you have the small intestine and stuff, later on in your GI tract, there are bacteria that make B12, but it's past the point of absorption. Okay, so our bacteria make it, but it's past the point of absorption. The train's already left. Basically, the party happens later down the track. That's how you can think of it. So with that, we need to think of ourselves as coming from a place of absolute negative in the whole balance when it comes to B12. It's the one supplement that I say is non-negotiable for my patients. I encourage them to start with 500 micrograms per day, especially if you're on medications like metformin or anything like a proton pump inhibitor that decreases your absorption. When you get your blood test, when you do your blood test, you want to make sure you're hitting around that 500 mark. That's great. 500 to 1100 is the optimal range. If you're above the 1100, just cut back, cut it in half, whatever you're taking. But most people I found need a 500 to 1000 micrograms per day, and that's more than sufficient. And the body is interesting. It'll take your intrinsic factor, it'll grab hold of the B12, absorb it, but there's also about a passive absorption, right? So you get a little bit absorption even by just taking larger amounts that doesn't require the intrinsic factor. So that's what I'm saying. So I would take more than the recommended RDA of 2.4 micrograms daily, just because where we're coming from, we're not going to have it unless we're taking it in supplement form or fortified foods. And even then, again, I would just rely on you don't want to have the side effects, which could be anemia, it could be permanent nerve damage. You'll feel better. You'll have more energy. Pay attention to your B12. I think I've said enough there. So again, why does it matter? I said nerve function. It's also important production of DNA in your red blood cells, okay? So take your supplement and you're good to go. Can you rely just on fortified nutritional yeast? I would say no. Take your B12 supplement. Okay, next is 3 is iron, right? So why does it matter? Well, a few different reasons, but recommended intake for women, adult women who are menstruating, still having their periods, is 18 milligrams per day. it's 8 milligrams per day for postmenopausal women and for men. Now I'm talking adults here. Kiddos going to have different amounts. Why is it important? I think we understand this. Iron's important for oxygen transport in the blood. So important, right? We don't want to become anemic. Now, one of the major things you want to check is the CBC, which is a complete blood count, or hemoglobin hematocrit. You want to make sure you're not anemic, right? And really important one to check is ferritin. Ferritin, you probably want minimally 50. You want to be closer towards 50. That is where I found that people do well. They don't have the hair loss, they don't have restless leg syndrome, they don't have that fatigue. You may not even be anemic, but your iron stores are low. So definitely check out the iron there. Where can you get it? Lentils, beans, tofu, dark green leaf peas, dried fruits. You can pair them with some vitamin C, get a little bit more enhanced absorption. But again, you don't have to. And be careful that you're not taking, those foods in with tea, things like that, because that can decrease the absorption. So pay attention to that. Next is calcium. So you want to hit probably 1,000 milligrams per day if you're under the age of 50. Above 50, you want to hit 1,200 milligrams per day. Okay. Why? I think we know this too. It's important for your bones, right? Muscle contraction, nerve signaling, all those things that calcium are needed for. Now, you absolutely can get enough of this through your diet. I like to make sure that when I drink my unsweetened soy milk, because I love soy products, like I said, I get the calcium enriched, right? So it will be around 300 milligrams per cup, which is great. That comes from calcium carbonate. Yes, I understand you can take it in supplement form, but I just prefer to take it with the food and mix it with other things so it's better absorbed. In that small amount, in smaller amounts, that's okay. Now, if you're finding that you're really struggling to get enough calcium in your diet, that's where supplements can come in, but very small amounts, broken up in maybe 2 or 3 times a day. It's when you take in large doses of calcium as supplements, it causes aggregation of the platelets. It can increase your clotting. So that's why we don't want to take large amounts of supplements. So if your doctor is like, oh, you have osteopenia, you have osteoporosis, and says, go take 1,200 milligrams of calcium plus your vitamin D, please be very careful of that. First, let's see what your diet's providing. And then if you're struggling, you can't, even by paying attention, you're struggling to get enough, then you can do a very tiny amount of supplement. But I would be very careful with that. Just paying attention. What can you do? Like I said, the fortified plant foods or milks. I prefer soy, tofu made with calcium sulfate, tahini, almonds, leafy greens like kale, bok choy. Those are great choices as well. Next is your omega-3 fatty acids, or the ALA, right? The plant-based. You want to get around 1,100 to 1,600 milligrams per day. Okay. So why does that matter? Omegas are really important for your brain health, cardiovascular function, and reduce inflammation. So these are going to be sources, going to be flax seeds, chia seeds, hemp seeds, walnuts. Now, if you're struggling to get that, I prefer the algae omegas, the omega-3s, because honestly, this is the easiest way to do it. I do eat some nuts, but I don't eat a lot of nuts. And so, I eat a handful a day. I do pumpkin seeds and walnuts, and occasionally pecans. They're my favorite. And so do I do some tahini on occasion, but I'm not doing it enough, I think, to get enough of the ALA. Because when we take in the plant-based ALA, we convert it at maybe a 5 to 15% rate. So you may not just be getting enough. You can do a blood test called an omega check. It's a pretty decent reflection of how much your omegas are in your blood. There is some debate on, or do we have higher amounts in our tissue where it's stored? Until we get a really good clarification about that, there's not really an RDA for omegas. That would be my recommendation. So moving forward, next would be zinc, right? So anywhere between 8 to 11 milligrams per day. Zinc is important for immune function, wound healing, and your DNA synthesis. Pumpkin seeds, that's why I eat the pumpkin seeds, but lentils, chickpeas, other nuts can also have that. So zinc is another one that's pretty easy. Now, let's talk about iodine. Recommended daily intake is around 150 micrograms per day. If you are pregnant, you will need more. If you are lactating and feeding a baby, breastfeeding, you're going to need even more than that. So it's really important to pay attention if you're in that special population that you take your prenatal, because they should have the higher amounts of iodine. Why is iodine important? Because it's very important for your thyroid health. I have had more than a few cases of patients who transition to a salt, oil, and sugar-free whole food plant-based diet, which is fine. Then they come back 3, 4, 5, 6 months later and say, hey, why was I told my thyroid's off? Well, it's because they didn't think about where they were getting their iodine. Iodine in most Western countries, it comes from iodized salt, which I think started in the early 90s, right? Because there was issues with goiters. When you take away salt and you think, or people like, oh, I'm not using iodized salt, I'm going to do the sea salt. Sea salt is not iodized, guys. It is not the sodium chloride that we want. We want the iodized, okay? So if you're not wanting to take salt, which again is fine, we need to make sure you're getting it in some other way. There's seaweed. You can do the nori, the dulse, the wakame. You can do an iodine supplement if you want. I take Complement. I take a Complement Essential and the Plus for Her system that has the iodine in it. And because I'm not a huge fan of that fishy flavor, I never was, even when I was a kid. So we lived in the middle of the desert. Probably wouldn't want to eat the fish that we got there anyway. So that would be my recommendation, to look at that. But pay attention to the iodine for sure. Now, vitamin D really is outside of typical dietary recommendations, but it is an important thing to consider. Vitamin D is important for your bone, your immune system, calcium absorption. I had one case back when I was in the Air Force. So this would have been, oh heavens, the 2006, somewhere in there. And I had a patient who mentioned she was always fatigued. So we did all these labs, right? Stone cold normal, except her vitamin D was like 3. It was crazy low. So we gave her the loading doses and got her up there. She did so much better. Her fatigue completely resolved. And I've had other patients who were low who had depression. So I think vitamin D is a really important thing that we don't even understand. It actually is a hormone when you look at its activity in the body. How much should you be taking? The RDA says 600 IU, 800 IU for people over 70. I personally think most people are going to need 2,000 IUs, international units daily or more. Probably 2 to 4,000. You can exceed the I wouldn't go above 4,000 unless you're under the care of a physician, just because that can lead into some toxicity. And so you want to be careful. This is a fat soluble vitamin. If you're overweight, I would say in the category of a BMI of 30 or greater, you definitely will probably need even more than the typical 2,000 IUs daily, just because it's a fat soluble vitamin and it's being stored in the fat cells. So you may notice that you need more. As you lose weight, you will notice that you don't need as much. So that's just something to pay attention to. Again, sunlight exposure, wintertime, higher latitudes, you're going to have trouble. Some people with darker skin tones are not going to convert as well. I don't convert as well. I lived in Florida, running outside, spending hours outside in short sleeve shirts. No, I know I should have, but no sunscreen. And I could not get mine above 27 without supplementation. I get supplementation. Now I just got my labs back. It was like 46. Perfect. I take 2,000 international units daily. So that is where you want to be. You definitely want to be above 30. Probably optimal is between that 40, 60. It's kind of more of a sweet spot. Being above 60 is unnecessary. So that would be my recommendation for you there. But be careful about how much you take. Selenium, another thing, it's important for your thyroid function. It's also a very strong antioxidant. You want to take around 55 micrograms per day. So you could do literally a Brazil nut probably once a week and be fine. Other things could be sunflower seeds, mushrooms, things like that are helpful. One other thing is K2. Now our bodies, it's a little harder to measure. So K2 is really important for heart health and bone health. So it's interesting because it's just important for the calcium metabolism. Somewhere around the 90 to 120 micrograms per day. You could add in some fermented foods like sauerkraut, natto, and sometimes you can even take a supplement if you wanted, probably 50 to 100 micrograms would be appropriate in the supplement. It usually comes with the vitamin D, and that's okay too. That's why, again, I like the complement, just because it has everything that I need. It's like my insurance. It's like my insurance policy, right? Because I really try to eat as well as I can, but there are days maybe I skip a meal because I'm working, or I focus in on some foods more than others. I mean, over the week, I'm doing great. But, on a daily basis, it's just nice to have a little bit of an insurance policy. Those would be the big ones, guys, that I'd recommend. And then the other ones that you're going to check are magnesium and potassium. There'll be a whole host of these other micronutrients that you're going to be looking at. So, but these are the ones I would say pay attention to, do your plant-based audit, and go from there. So what you do is when you get the Cronometer, for example, you're going to set up your profile. You're going to enter your age, your weight, your height, your activity level. Again, that'll help you generate the nutritional targets. And then you're going to track your meals, everything you eat and drink throughout the day, plus supplements, and pay attention to your serving sizes to make sure they're accurate. And you're going to do this for a week, okay? You're going to check those reports for your vitamins, your minerals, and your macronutrient distribution. You're going to look for any gaps or areas that maybe not meeting your recommended daily values. So then you can adjust your diet, right? You can track and tweak. I have a framework called ROOT. Recognize your why, right? When you're doing a plant-based diet, because that'll help you get over the struggles. You optimize your plate, and there's different ways to do that. It's kind of what we're talking about here. You overcome your objections, or you overcome obstacles. Those are going to be really important, planning ahead. And then T is what we're talking about today. Track and tweak. Track and tweak. Like Tweety Bird. I don't know why Tweety Bird came into my head, because I said tweet. Anyway, back on track. So do that over a period of time for about a week, and that'll give you plenty of data to make sure that you're doing things appropriately. And again, guys, it doesn't have to be perfect every week, but for the most of the time, over the course of a week, I'd recommend this for optimization. Eating all 5 categories: fruits, veggies, beans, whole grains, nuts, and seeds every single day. Color the rainbow. Try to get the color rainbow every day, but at least over the course of a week, make sure you're getting the colors of the rainbow. For the most part, you should be pretty good there. But the nuts and seeds are really, really important. People are nut phobic. I have no idea. They are fat phobic. It's just a handful of seeds. They have valuable minerals. If you look at the totality of the evidence in the whole nut form, it's fantastic for your heart health. It's great for your cholesterol. Again, very important. It's got some great minerals and such. So please do not be nut and seed phobic, please. Next, you want to consider those particular supplements, the B12, the D, and the omegas. That's, again, up to you. Diversity. Think about your bioavailability. Are you on certain medications that are decreasing? What things you can do. Again, soaking, sprouting, lots of ways you can do that. Making sure you're staying hydrated. I just throw that at the end. Hope you found that helpful, because really auditing the plant-based diet can be quite helpful to make sure you're getting the optimal nutrition. So if you're wanting to do a little more deep dive and need a little more help, we do have a free masterclass that Brittany and I do, Brittany Giroudi. It's called Master the Plant-Based Diet, Lose Weight, Reverse Chronic Disease, but everybody will get some benefit. We talk about the 5 common steps or 5 common mistakes people make. Excuse me, I need a drink. I saw patients all day, so I'm a little bit, my throat. When starting a plant-based diet, really had to avoid them. We talk about that 4-step blueprint framework that I go deeper diving into it. And then we talk about the number 1 most overlooked key to mastering your plant-based diet, that it's not recipes, it's not food. It's so important. So definitely check it out. The link is in the bio. And if you head over to Amazon, I think I need to update the link for the bio here. Here's our book, guys. Why did we write this book? Plant-Based 101. It's a manual on how to start and maintain and thrive on a plant-based diet. So if you have questions about protein, it's in here. You have questions about calcium, it's in here. You have questions about your labs, it's in here. If you have, how do I get started with recipes? Recipes included. How do I do this with kids? It's in here. How do I do this with older people? What about athletes? Guess what? It's in here. How do I deal with, family members who say this? Strategies in here. How do I start? It's in here. What is a whole food plant-based diet? It's in here. So you hear me? You hear me? So definitely check this out. We wrote it. It's not meant to be a Dr. Greger book where I give you 600 references and deep dive into the science. That work is for him. My work is practical application. Mine is the tracking and tweaking. I'm the one that where the rubber meets the road, and I see the patients. I've seen thousands of plant-based patients. Hence, this comes from that. It comes from over 13 years of my own plant-based journey. So I hope you found this helpful. And as always, I'm sending gratitude, joy, love, and healing your way because, oh God, we need more of that in this world. So everyone, have a wonderful, wonderful rest of your day. And I will see you next time.